course, doctors are often the first port of call when you do have a health concern, but reports say that some GPs are having to squeeze in as many as 90 appointments a day when the recommended number is just 30.
Well, smartphone apps that can diagnose medical conditions are one option that could help ease the pressure. But with plenty of apps out there that aren't regulated, Dr. Zand is giving his diagnosis on whether they're always a smart option after all.
Detecting health problems early is often the key to effective treatment, and this usually starts with a visit to your GP.
But for some health conditions, the process of getting a diagnosis could soon be done by this. Smartphone-based tests are being developed that allow patients to test themselves and then get the results instantly via an app.
As a doctor, I'm normally pretty wary of technology that claims to replace medical expertise. But I'm curious to find out how other people feel about the prospect.
What do you think about using a smartphone test to diagnose potentially a serious health problem?
I would say 50-50 because people wouldn't trust it as much as a doctor would say it to their face.
I'd rather the personal touch of being able to actually speak to a human.
What do you think about the benefits?
Takes the pressure off NHS staff. People with disabilities who can't get into a doctor's surgery, it's got a lot of potential there, but I don't think it should be used as a replacement. It should be used alongside current stuff.
Maybe minor problems I'd look at, which you can do on Google anyway. Yeah, but I don't think I trust them for very, complicated things.
Well, there's certainly some skepticism here in Cambridge, but I'm keen to see one of these apps for myself. I'm meeting Steve Roost, the CEO of a company called PocDoc. They've developed a smartphone-based test for high cholesterol, a usually symptomless risk factor for cardiovascular disease and stroke.
GP surgeries, pathology labs are under an enormous strain at the moment, and we represent a solution, all working with the NHS to take that strain off and get more people diagnosed and get more people treated.
This is a thing that I could do at home, potentially.
If you're comfortable testing yourself at home, we want to facilitate that. But there will be thousands of people that would prefer to just pop down the road to their local pharmacy and do the test there. And that we want to make sure that everyone has equal access to the technology.
Can you do a test for me now?
Absolutely, yes, I can.
Brilliant.
So it's a small finger prick, and we then use a specifically manufactured pipette to gather the right amount of blood so that there's no room for error. And then we apply that blood to the chip.
Alongside a health questionnaire, the test uses a lateral flow device, the same system as a COVID test, to measure for 5 cholesterol markers in just 6 minutes. And getting the results is easy too.
You take a photo.
And then push the button.
There we go.
Process test. That's pretty easy.
The blood has reacted with chemicals on the test and subtly changed colour. Those colour changes are captured in the image, which, when analysed through the app, can tell you about your cholesterol levels.
Whoa, it's done.
There we go.
That's it.
That's it.
So it went all the way to your cloud.
Yep.
The artificial intelligence looked at it, looked at the colours, and now I've got it. So, oh, this is great.
Your cholesterol levels have looked
That is good. Look at that.
Yeah.
Great. I'm completely delighted with this.
I'm very pleased with my result. But if the test had identified any concerns, they would immediately be shared with the clinical team for further investigation. This test is due to be available through some areas of the NHS and commercially through some pharmacies from early this year. Although slightly less accurate than traditional lab tests, these self-test kits will mean more people can be tested, helping spot issues sooner in patients who could otherwise be missed. And it's not just cholesterol. GP Dr. Anne Baldwin's patients have been using smartphones to test for kidney disease, something that 3.5 million people live with in the UK. But now just a simple urine sample and a phone could help us get that potentially life-saving early diagnosis.
So you're looking for effectively protein in the urine, which is a sign of kidney disease. Which patients are you targeting with this?
So the population we are targeting is diabetes and hypertension group of patients, most specifically for patients who are housebound, hard to reach population.
The test, which in this case is just as accurate as the one used by a GP, is made by the company Healthy.io. It analyses the colour of the dipstick against a colour board after the urine has reacted with the chemicals.
Do you have a sense that you're being replaced as a doctor by this test?
I think it's just supplementing, what we're doing. You are only targeting the high-risk group, and then you're preventing them from getting worse.
The test is being used by the NHS in many areas across England, and it's estimated it will help save more than 1,200 lives over 5 years. Healthy IO put us in touch with Robin, a patient who's used the test.
So, Robin, you've actually used the kidney test. Can you tell me what it was like?
I received the kit through the post. The accompanying video with the app was very, very good. I was so delighted with the result, which said I was A-OK.
And how much time do you think it saved you?
Well, it would have incurred a trip into the local town. This was instant, and so it did save a hell of a lot of time for me.
The smartphone-based tests that I've seen today have undergone extensive clinical testing and really rigorous regulatory approval. But there are thousands of apps out there that claim to diagnose and treat real health conditions that are available for anyone to download that have really not gone through such rigorous testing.
Dr. Tom Micklewright works with the Organisation for the Review of Care and Health Apps, or ORCA. They assess healthcare apps for NHS trusts. He's also a GP.
For all the health apps that are out there, then only about 1 in 5 pass our safety checks.
What sort of standards do you need an app to meet in order to approve it?
We take a look, firstly, at the data and the technical security of the app. Can the average patient use it? If the patient has maybe sight difficulties or hearing difficulties, is that a barrier? And then finally, we have a look at the evidence and the safety of the apps.
If people want to get apps that address a health problem or their health in general, how should they be choosing them?
ORCA have worked across 70% of regions in the NHS to create approved app libraries. So these are libraries of apps that have been assessed and are safe to use. So it suggests go onto your GP surgery website, go to your local hospital website and see if they have a list of approved apps that you can use. If you're in a region that doesn't have access to the library, I would say at the very least, discuss it with your doctor, your GP, or your nurse.
There's a confusing choice of health apps out there.
We should be very wary of unregulated apps, but even for the regulator-approved ones, it should never be about replacing healthcare professionals so much as taking the burden off the NHS and improving access to high-quality testing for everybody. And if we can get the balance right, then my diagnosis is it could be great for healthcare professionals and their patients.
Wouldn't it be great to get that balance right? The cholesterol stuff's really interesting, isn't it? Being able to monitor day to day. How chuffed was Zand about his results, by the way? He was really happy, wasn't he? Oh, I miss Zand. Zand coming
We'll be back
to you?
soon,
Will he?
hopefully.
Okay, thanks.
Unless, you know, he
do
decides
miss
to
him.
stay in Australia, who knows?
No, he won't do that to me.
I'm sure he'll come back to you again.